A concerning case of measles to tell you about tonight. Health officials say a child with an infectious case spent hours at Mall of America's Nickelodeon Universe late last month. Anyone there on the evening of May 24th may have been exposed. Brittany Ehrman joins us now with what you need to know and how families can stay safe.
Lindsay, the Mall of America case is one of two new infections announced by state health officials. This case is really causing concern because they don't know how the child got sick. We spoke to a doctor who says it does not take much to catch the virus. A popular area in Mall of America known to be a kid magnet was the site of a measles case.
There's a very high risk of transmission. One infected person could infect 8 or 9 or 10 other people.
The Minnesota Department of Health says on May 24th, an infected child was in the Nickelodeon theme park from 5 to 9 at night.
It's not like a lot of other viruses where you need to have someone right up in your face, maybe coughing on you or something like that for you to get it. And that's the risk with this virus.
State health officials know the child is unvaccinated and lives in Dakota County, but they do not know how the child was exposed. MDH says the child has not traveled outside of Minnesota in the last month.
This is a serious disease, and it is easily preventable with the measles vaccine.
We took a look at the data to see how many kindergartners got vaccinated for measles. Back in 2015, 93% of kindergartners got the shot. But 10 years later, that number dropped. In 2024, 86% of kids got the vaccine.
There are children who have died from measles, so it can be very serious.
Dr. Eric Barth with Allina Health explained it can take 8 to 12 days from exposure to develop symptoms. That can include a fever, cough, runny nose, watery eyes, and a rash. Mall of America tells us they did not learn about the exposure until days after the child was there. They added they have, quote, extensive daily sanitation protocols for all rides, food services, and mall common areas. The second measles case announced today is unrelated. It involves an adult who was exposed while traveling outside Minnesota. MDH says both the child and the adult are recovering at home. Now, if you think you or your child may have measles, it's important to let the clinic know before you enter the building. They follow certain steps to protect other patients. Lindsay?
All right, and it's important, Brittany, that you're getting this information out for everyone. There have been 4 cases of measles in Minnesota so far this year. Other states are faring far worse. As of May 29th, there have been nearly 1,100 confirmed cases reported in 33 states and 3 total deaths. Texas has the most cases with more than 250. Americans are now being urged to get vaccinated against measles no matter where they go overseas. The CDC is updating its guidance to international travelers. They say cases are rising in many countries around the world, and most people who bring it into the U.S. are unvaccinated residents who get infected during international travel. Children at least 1 year old, teens and adults who are unsure of their immunity should get 2 MMR vaccines at least 28 days apart before their trip.